So let's say you have a patient that comes into your treatment room and you're saying, "Hi there, how are you?" And they say they're good because they're a nice person. And we all know they're in your clinic because they're feeling terrible. So they're lying to you and they're saying, "Yes, I'm wonderful." So at this point, as your patient's entering into your treatment room, you should already be taking in data because your patient's coming into your treatment room for treatment. So you should be looking to see, how are they coming in? Are they hobbling in? Are they limping? Are they slow? Are they guarding a certain part of their body? Right from the get-go, you can get information about the patient's presentation. Now, at the same time, you can be asking the patient, "Oh, wow, I see you're having some trouble moving your legs. Okay, how long has that been happening? When did it start?" And so now the patient's starting to talk about their legs and how their legs feel heavy. And they say that they've had a harder time getting their socks on. And even they're having a harder time getting their feet onto their bed at night because their feet just feel so heavy. So at this point, you help your patient onto the treatment table and you can start to inspect other parts of their body. So when you look at their feet, you're looking for what? You're looking for changes in skin color. Maybe you're looking for changes in musculature. Is there atrophy involved? What's the color of their skin? What's the temperature of their skin? Is it hot to the touch? Is it cold? You can even assess the skin for moisture. Like, is the skin dry or is the skin wet? And when you look at the muscles, when you palpate them, you can see if there's atrophy or maybe there's swelling. Now, all these different presentations, they correspond to different things. So let's say, for example, when you inspect the legs, you notice that the legs are swollen. When you press your finger into it, the skin, it makes an indent, and it takes some time for that skin to return to normal. You also notice that when you touch the skin, it's slightly weeping, like it's slightly wet. So then you bring that data and you start to ask questions. How long have you had this swelling? How long have you had that weeping? Does your primary doctor know about the swelling? Are you taking any medications for the swelling? And when you're evaluating your patient and you're finding some of these symptoms and they just make you feel like a flag is raised, then you should always recommend that other disciplines see them. So you can refer them back to their primary care or you can refer them to a specialist, however you see clinically fit.